So what are some of the symptoms? So, do you have adrenal fatigue? Again, because it's this nexus diagnosis. It's not really technically a diagnosis. Nobody in medicine will ever tell you that adrenal fatigue is a real thing. But how does it start? What are the kind of some of the things that really begin? And so this is kind of a list of symptoms that we can see that many people will develop. So again, not everybody has all of these symptoms. Not everybody will develop every single one of these symptoms, but these are things you can look at. Now, these things over here are more common. So one of them is chronic fatigue. That, in my experience, is probably the most common, is just chronic fatigue. What a person will oftentimes say is, 5 years ago, 6 years ago, I could work all night, I could play all day, I could stay up, I could drink, I could exercise, and I could cruise, and I wouldn't have any problems. Now, the smallest amount of stress completely wrecks me for 2 or 3 days, right? That's where that chronic fatigue starts to set in. What's happening here is a person is becoming stress maladapted, meaning their adrenal glands are starting to get tired because they've been overworked for too long. And this will also be accompanied with muscle weakness. And one of the reasons why is that you, again, initially in some of the earlier stages of adrenal fatigue. So think of adrenal fatigue as not as, your adrenal glands are tired or they're not tired. Think of it, there are stages of what the adrenal glands go through. The initial stage of adrenal reaction is what we call the acute stress stage. Let's make some more room here. So you've got acute stress, which generally, if it's truly acute, meaning it lasts for a few days at most, it then goes to your body. So acute stress, your body responds to acute stress by increasing cortisol and adrenaline. And as long as the stress goes away, right? When the stress goes away, this will drop and everything will come back to normal, okay? This is where the problem sets in, is when there's chronic stress. Stress lasting for weeks to months on end, and there's no reprieve, right? And so initially, again, with acute stress, these things go up. Your cortisol goes up, your adrenaline goes up. Those are things that initially will elevate. And in an attempt, your body, what it's trying to do is it's trying to make hormones that help you adapt and deal with stress. But if that stress stays there for too long, you'll actually see, so going back to this diagram, right, where cortisol kind of follows that curve, right? What you'll see with acute stress is instead of this curve, you might see a minor spike. But with chronic stress, what you're going to see a lot of times is that morning time cortisol is even higher. It's even higher. Sometimes I see it in people off the chart. And then we might get where it drops, and then we might get a spike in the course of the day. So you get instead of like this smooth downward trending curve, you might see it drop and then spike back up and then kind of drop again. Like that's a pattern. So there are different patterns with chronic stress, and so it's because your body is trying to adapt to the stress. So the longer it's there, your cortisol levels will start to yo-yo and they'll start to seesaw. And as that happens over time, initially that cortisol, that adrenaline are high, but the longer this goes on, beyond the with the chronic stress, the longer this goes on, these hormones will then they will really start to plunge. Right? So instead of being high, they'll really start to plunge, and then you won't have adequate cortisol. And when you hit that point where your cortisol's on the floor, maybe your cortisol, instead of it being way up here and curved like that, it's just kind of flatlined, right? At the different times of the day, it doesn't really change. There may be a 5 to 6 point differential in these as opposed to a 10-point differential. But this is more of a flat line. And this is when you're in bed all day. This is when you're tired all the time. This is when you wake up after sleeping for 8 or 9 or even 10 hours and you still wake up tired and you have a hard time peeling yourself out of bed. That's chronic stress, right? And this can take, depending on the person, there are a lot of variables here because it depends on how well a person eats, whether they exercise, get sunshine, whether they go to bed on time, whether they're dealing with a lot of job stress, whether they're dealing with a lot of relationship stress. So like a lot of it is dependent on multiple factors, which can make it challenging and hard. But ultimately what happens, that person loses their ability to adapt to stress because they are flatlined. This is, again, that stress maladaptation is because they flatline out their cortisol. They can't get a boost out of it, and so they can't function. And this is, a lot of times where people, again, chronically, they're in bed. They don't want to get out of bed. They have chronic fatigue syndrome, CFS. They have muscle weakness. Their muscles are deteriorating. They're in bed. They're tired all the time. They're not exercising at all because they can't tolerate it. So exercise intolerance is a very common symptom of adrenal fatigue. And then we get, we can get abdominal pain. And one of the reasons why they get the abdominal pain is because chronic stress hormone production and chronic stress shuts down the gut. It shuts down the motility. It shuts down how well you digest. Chronic stress reduces gastric acid secretion, reduces enzymatic production, so enzyme production by your pancreas and by your GI tract, so you don't digest your food as well. So now your food sits inside of you and it kind of rots inside of you, and that can lead to a lot of abdominal symptoms and pain. We also get weight loss initially, right? So in an earlier chronic stage, so again, this is where there's nuance to this, and so before you're completely maladapted to stress, there's a stage where it's predominantly, I'm tired all the time, but it's not weight loss, it's actually weight gain. Because initially, remember what I showed you a minute ago with that cortisol curve. Initially, let's move this out of the way again, you might be in a state of earlier chronic stress. Again, there are levels of chronic stress where your cortisol is way up here and it's staying higher. It's dropping in a normal type of pattern, but overall you're producing more of it to cope and adapt to the stress. And remember that too much cortisol, what does it cause? It causes muscle loss. It causes bone loss. It can elevate your blood sugar, right? Which leads to weight gain. So this is part of the, kind of an earlier, think of this as an earlier stage of the beginnings of adrenal fatigue, but multiply that over months to potentially out to a year, and that weight gain starts to deteriorate because you're losing muscle mass, you're losing bone mass, your appetite's not there because you just don't want to eat. And that's where this really starts to kick in. So a lot of times, again, earlier stages, we'll see weight gain, and then subsequently weight loss will come after that. And then these are some of the additional possible symptoms that we'll see sometimes people will manifest with: nausea, vomiting, diarrhea. So again, what are these? These are all GI symptoms. Your body's saying don't eat. We don't want the food because we're not doing anything with it because the stress hormones are shutting down the digestive tract. And so your body's trying to reject food. Lightheaded when standing up because, again, chronic stress can affect your blood pressure through mineralocorticoids and hormones like aldosterone. Irritability and depression, joint pain, severe salt cravings. I hear this a lot. People crave salt. This is especially true in the later stages of adrenal fatigue. And then we get low blood sugar. Initially, it's high blood sugar, but over time, the blood sugar levels become hypoglycemic because people can't regulate how they're processing carbohydrates, and so they can't make energy from the food they're eating. Irregular menstrual cycles or no menstrual cycles, the chronic stress will shut down sex steroid production, and no interest in sex, so libido on the floor, and severe enough, you get darkening in the folds of the skin, so like in the elbows, the backs of the knees, the back of the neck, that skin will start to turn very, very dark. And that's not a good thing. That's a later stage. So problems with chronic stress. I've mentioned this a number of times, and this is where a lot of people are symptomatically. So it's these problems with chronic stress. And so some of the most commonly reported symptoms before a person gets that adrenal fatigue label, right, are these things start to happen. Okay, and we mentioned fatigue, we mentioned weight gain already, is water retention. right? If you've ever taken a corticosteroid, like the drug from the doctor, whether it was an injection or whether it was oral, one of the first things that happens is you put on like 5 to 10 pounds. And that's water weight retention, and that has to do with the electrolyte balance. And so a lot of people will actually be packing 10, 15 pounds of extra water when they've been chronically stressed because they're making their own steroid, right? And they're storing that excessive water. Muscle loss, bone loss, I mentioned. Elevations in blood pressure and blood sugar and low libido, also mentioned as well. So again, why does chronic stress cause these things? Because chronic stress drives up cortisol. That's what you do not want. You do not want your cortisol to be high. And remember, what is chronic stress? It's lack of sleep, it's diet, it's infection, it's all the things that we talked about that can drive the stress response. So it's important that you have a plan, right? Because if this is you, if you're here already, what's your plan to get out of here, to get away from this? You have to have a plan. What's the old saying? Failing to plan is planning to fail. And so for many people, the plan should look, before we get to this slide, I really want to talk about more of the plan as you should be thinking about it, right? So number one, sleep often. Sleep a lot, okay? When you're in adrenal fatigue and you've been struggling with it for a while, the regular 8-hour time framing around sleep is not, in many people's cases, effective enough. So we've got to get sleep, and this includes naps. So if you find yourself, dragging in the middle of the afternoon and you can't function, and your brain can't think clearly, and your body's telling you to go to sleep, take a nap. We have this in America, we have this guilt complex around taking naps. We think somehow if we take a nap, indicates we're lazy or inadequate as a person. But nap is just nap feeling tired around the noon time is just your body's way of saying go to sleep. Now, a lot of cultures take naps anyway. They take a 20-minute siesta after eating. And the reason why is they just dumped a bunch of food in their GI tract. Instead of stressing themselves out by working, they can now go lay down for 20 minutes and let their body do that job of sending the blood to the GI tract and helping them digest the food so they can get good nutrition out of the food. But napping can be very effective. Sleeping a lot is what I would call a non-negotiable, right? It's a non-negotiable. You can't negotiate with sleep. You can't barter with it. You can't argue with it. You need it, and you need to make sure that you're getting it, especially if you suspect that you're in a state of adrenal fatigue. Number two is avoidance. What does that mean, avoidance? Avoidance of the things that you know are triggers, are your stress triggers. So avoidance could be food. And this is one of the things, if you don't know, get it measured, get it tested. Because if you don't know, food could be your best friend or food could be your worst enemy. But if food is your worst enemy, remember the act of eating is designed to nourish the body. But if instead for you, the act of eating is causing inflammation, then it's just driving that stress response. So you really want to understand. One of the more common food elements here is gluten. If you don't know whether or not you need to go gluten-free, take our quiz. It's simple, it's free. I'll put a link into the feed for you where you can take that. And if you want to dive in deeper, you can do genetic testing as well. But avoidance of food, also avoidance of chemical toxins. We live in this polluted world. And many of you have traded your health for the convenience of that world. And so, examples of chemical toxins would be plastic water bottles, right? It's very convenient to be able to buy that and drink out of that plastic, but that plastic is a chemical toxin. That phthalate, even the BPA-free water bottles, there are phthalates in those water bottles that act as pseudoestrogens and chemicals that can stress out your endocrine system. So get rid of that stuff, right? Drink out of glass. Ideally, filter your water, filter your air. These are chemical toxins. You can filter them, you can control them, you can mitigate your exposure. It's very important that you make every attempt to do that. And there are other chemical toxins. We don't really oftentimes think of EMF as a chemical toxin, but many people with chronic fatigue and adrenal burnout have EMF hypersensitivity, meaning they can't be around Wi-Fi. They can't be, if you've got that phone in your hand and you're on it all the day and you're being constantly exposed to large quantities of EMF and you've become EMF intolerant because you're stress intolerant, it can be very hard to make a comeback. So turn the Wi-Fi off at night, like give yourself time away from it. So avoidance of the things that are poisoning you, right? And then we want to embrace the things that heal us. So what is this? This can be perceived in a lot of different ways. What do you want to embrace? You want to embrace real food. Real whole food, organic food, right? Because the pesticides and the other toxins that are found in a lot of the boxed and processed foods, what are those? Those are chemical toxins, right? And your body's overwhelmed. So eat real food, not fake food. You can also embrace things like exercise to tolerance. Now, again, if you're chronically adrenal fatigued, you may not have much tolerance to exercise. All you may be able to do today is walk 800 meters to the mailbox and back. That's okay. Walk the 800 meters. Embrace what you can do. Don't be discouraged by what you can't, but embrace the things that you know are going to put you back on the right path. So again, embracing exercise to tolerance, embracing spending time outdoors, outside. Being outside is a very healing thing. As a matter of fact, it's before the drug cartels took over health and medicine, spending time outside was a common prescribing practice of doctors because they knew that spending time in nature had healing aspects, even if they didn't understand what those were. We understand them a little bit better today. Certainly there's vitamin D. We know the healing aspect of the sun as it relates to the production of melatonin and endorphins. Sunshine can help your brain make endorphins, which help you feel better, which can block pain receptors, among other things. So it's an easy thing to embrace that. Embrace the people around you who you know care about you, but don't embrace the toxic relationships. Like, give yourself distance if you know there are toxic relationships that you're just putting up with. Those things are going to potentiate a complete lack of response in terms of trying to recover. So you really want to embrace things that help you heal. And that's sleep, sunshine, exercise to tolerance, the right relationships, eating real food, all critical, all non-negotiable. If you don't do those things, you're going to really, really struggle to make a comeback. Now, beyond those things, there are some supplements that can be very supportive of adrenal gland function, and I want to talk a little bit about some of those. This is not a comprehensive list, so if you are thinking in your head, why doesn't he have licorice on that list? This is not the end-all be-all list, but it's a list to get you started and going in the right direction. So some of the things I'm going to highlight, this over here, the vitamins and minerals I'm going to highlight because these are the most important. These right here are more important than the adaptogens, the glandulars, and some of the other plant-based compounds, which is what these are, okay? These things here are essential for your adrenal glands to be able to function. You cannot adequately produce cortisol. Your body needs pantothenic acid. Pantothenic acid, it's vitamin B5. For those of you maybe that don't know, it's vitamin B5. Its nickname is the anti-stress factor because it combats stress by helping you produce the hormone that helps you cope and deal with stress. So if you don't have enough pantothenic acid, or if your vitamin B5 is deficient, you're going to really, really struggle. This is essential, right? These things are essential for function. These things are beneficial in the way that you feel, right? So vitamin C is absolutely critical. You can't make cortisol. And again, you can't make cortisol without vitamin C. So think of vitamin C and vitamin B5. That's why they're number 1 and number 2 on the list as the most important things that you could get more of. We know from numerous research studies that when stress goes up, vitamin C need goes up. And when we match stress to vitamin C intake, a lot of times we can keep people from even becoming sick. This is what we saw in the last 2 years with the intelligent doctors who were out there treating, this ubiquitous virus with vitamin C. They were treating it with vitamin C, and of course the people that got that did so much better in their recovery. It's because they were matching the stress of the infection with enough vitamin C to help combat it. And we know zinc. Zinc is very important in this regard as well. Zinc is important in the production of hormones. Now, if we're talking about this, up here we're talking about cortisol, but we can talk about the biochemistry of adrenaline production, which you need. For adrenaline, you need vitamin C. You also need copper, which is very important in that regard. And zinc and copper are important to take sometimes together because they balance each other out. We know we need B vitamins. Biotin's one of them. Vitamin B3, sometimes called in biochemistry NAD, in a nicotine adenine dinucleotide. This B vitamin is important for the production of cortisol as well. We also need, for adrenaline production, you need adequate protein. One of the things that happens with chronic stress is people's protein levels drop, especially if you're following some of the newer trends like the plant-based diet. If you're under tremendous stress and you start a plant-based diet and you're not getting adequate protein, it can actually put you to the floor. It can actually be the tipping point that breaks you. One of the things that comes in protein is tyrosine, which is a precursor to production of producing adrenaline. And you also need vitamin B6 in that process. So these nutrients are very, very critical for the biochemistry of how your body is capable of producing cortisol and adrenaline. And if you don't have adequate quantities of them, but you continue to embark upon a high-stress lifestyle, this is what adrenal fatigue is you run out of these essentials, and that's when you flatline, that's when you crash. So it's very important. Again, the best thing to do is to measure these nutrients, and all these things can be measured. It's very simple to do. If the doctor understands nutrition, they can measure this, and then they can give you kind of a customized blueprint to follow in terms of helping you, because not everybody with adrenal fatigue needs to megadose with every one of these nutrients. Sometimes it's just a handful or a few of them. And then we have over here, we have some other things that can be beneficial that contain a lot of different types of flavonoids. But rooibos tea, this is one thing that you can do. It's a food. You can certainly eat it or rather drink it. Pomegranate is another. It's a food you can eat. Flax, cacao, green tea, and then adaptogens. And adaptogens like ginseng can be very helpful to helping the body cope with stress, as can glandulars. And glandulars are basically like eating organ meat. It's like eating adrenal meat. You're eating the organ meat. And so there are a lot of nutrients within the organ meat itself, right? There are a lot of nutrients. These nutrients are found in a lot of the glandulars. And so those are also things that can be very, very helpful. I've seen people who were on their couches every day, all day, tired, and using a glandular was the thing that got them to be able to get up off the couch and actually start functioning again and start taking some action to improve their health. So again, these are things that can be helpful, but I think it's important that you go back beyond these things and you really focus on making sure you're doing these other things first, right? Which is the sleep, the avoidance of the wrong foods and other trigger factors, and embracing things that help in the healing process. And that also, we didn't really talk much about it, but meditation can be very, very effective. Yoga can be very, very effective as a tolerable form of exercise. And then there's one other therapy I think worth mentioning, and that's sensory deprivation therapy, which is a type of it's basically, have you ever heard of a float tank? It's a large bathtub full of magnesium salt, and it's so much magnesium in the water that you float. You're buoyant, so your body floats. And you do this in a controlled environment where you're wearing blinders so you can't see, you're wearing earplugs so you can't hear. The temperature of the water is the same temperature as the core body temperature, so you're not feeling, and you're lying in water floating, so there's no gravitational force. So you're depriving yourself of sensation, of sight, of sound, of gravitational force and proprioception and temperature change. And so that's why it's called sensory deprivation. It reduces all of the external input, or a lot of the external input, so that your body doesn't have to process extra, and it can just simply relax. And it can be extremely effective as a first-line tool if you're really struggling with chronic adrenal fatigue and you need something extra to help you overcome.